Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk, so please show your faces in the video. A reminder after the pep talk is to take the online learning cum evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate like the one shown here. I have placed the link in the chat box already. Then another reminder, obtaining 25 OLETE certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now, show your faces. Okay. Ready? All set? All set? 1, 2, 3. I have a patient empowerment program, which I like to empower the lay people or patients to take control of the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. May 17, 2025 marks the start of year number 5 for the ROJoson pep talk. How long the pep talk will last will depend on our enthusiasm, discipline, and perseverance of everybody, you and me. My pep talk today is entitled How to Live a Life with a Threat or Risk for Cancer Development, Recurrence, and Death. The empowerment objective is for the lay people to have an essential understanding on how to live a life with a threat for cancer development, recurrence, and death as part of their health management. The contents of this pep talk will be the following. What are the 3 statements of fact and reality on cancer? What are the management strategies on the 3 statements of facts and reality on cancer? And then how to live a life with a threat for cancer development, recurrence, and death, and what are the coping strategies. Disclaimer, this ROJoson pep talk contains my thoughts, perceptions, opinions, and recommendations, or TPORs, culled from personal experiences as well as from the writings of other health professionals. Let's start with the 3 statements of fact and reality on cancer. Statement 1, every human being on earth lives with a threat of cancer development. There is no escape from this threat. There is no absolute or sure way of preventing cancer development or from having a cancer. Although not everybody would eventually die with a cancer, everybody and anybody can be affected with a disease called cancer. So this is statement number 1. Statement number 2, once a cancer has developed, despite the best of treatment, there is always a threat for recurrence. No physicians can make a guarantee or 100% assurance of no recurrence, as the exact definite cause of all cancers is not always known. Treatment of cancer, at least up to this time, is just treating the cancer and not the cause, because the exact cause is not known. Thus, there is always a possibility of recurrence after treatment, even with the best of hands. Physicians do not promise cure after treatment. Physicians do not talk of cure after treatment. They talk of remission, meaning no evident cancers at the present time, but always with the possibility of recurrence anytime. Statement number 3. Once a cancer has developed, despite the best treatment possible and available, and most modern and advanced at that, there is always a threat or a risk for death from cancer. There is no absolute or sure way of preventing recurrence after treatment, and therefore, no absolute or sure way of preventing death from the recurring cancers. Though having a cancer is not a death sentence, there is always a threat of dying from a cancer. So those are the 3 statements of facts and reality on cancer. So with the grim statements of facts and reality on cancer, what to do in living a life with a threat for cancer development, recurrence, and death? And what are the management strategies on these 3 statements of fact and reality on cancer? The first management strategy or advice is to accept the grim reality, then pray and hope, but be prepared on how to respond to these threats when they become a reality. The second management strategy or advice is to still try your best, our best, as much as possible to prevent cancer development, cancer recurrence, and cancer death. The question is how? The question is how? So let's start with the cancer development. Best effort in preventing cancer development. Be educated and empowered to know and then avoid all known, probable, and possible carcinogens, which means agents that promote the development of cancer, both from the environmental exposure as well as from the dietary intake. Live a healthy lifestyle, then pray and hope for no cancer development. If still with cancer development despite the above, accept it. Be contented that you have done your duties and responsibilities, best effort, then declare, thy will be done to our Creator. So the first and the best effort will be to know and then avoid all known, probable, and possible carcinogens. Here is a list of carcinogens to avoid in everyday life: tobacco smoke, alcoholic beverages, ultraviolet radiation, processed meats, human papilloma virus infection, Helicobacter pylori infection. And then for those in the occupational setting, asbestos, radon, benzene, formaldehyde. All the above mentioned carcinogens can lead to different types of cancers in the human body. So strategies for reducing the exposure. Reducing exposure to known carcinogens involve making informed choices. Tayo magde-decide after knowing everything and adapting protective measures. So to minimize the risk from tobacco, completely avoiding smoking and also secondhand smoke is very important. For the alcohol, adhering to recommended limits or abstaining entirely can lower the risk of associated cancers. Protecting against ultraviolet radiation involves regularly applying broad spectrum sunscreen and avoiding artificial tanning devices. Dietary adjustments can also help. Limiting the consumption of processed meats such as bacon and sausages is a practical step. Regarding infectious disease agents, vaccinations against viruses like HPV, that's human papillovirus, and HBV, hepatitis B virus, can significantly reduce cancer risk. In the home, testing for radon gas levels and implementing mitigation systems can lower exposure to this naturally occurring radioactive gas. In the occupational settings, adherence to safety protocols is important, which may include using personal protective equipment and ensuring proper ventilation to limit exposure to industrial chemicals like benzene and formaldehyde. Choosing products with low or no formaldehyde content in building materials and household items can also decrease the indoor air levels. Reducing exposure to outdoor air pollution involves checking air quality indices, limiting outdoor activities on high pollution days, and supporting policies aimed at reducing industrial and vehicular emissions. So be, be educated and empowered to know and avoid all known probable and possible carcinogens. Then, after that, we go to the living a healthy lifestyle as the next strategy. So what do you mean by living a healthy lifestyle? The components are these ones, at least the key ones. Number one, healthy eating, regular physical activity, adequate sleep, stress management, avoid harmful habits, maintain a healthy weight, preventive health care, healthy social and emotional life, and a clean and safe environment. So these are the key components of a healthy lifestyle. Now, as to the third element in the best effort, so after the knowing and avoiding all known probable and possible carcinogens and living a healthy lifestyle, the last one is to pray and hope for no cancer development. You can only do so much, but fulfill your duties and responsibilities to yourself. As I said, best effort, thy will be done. Now, as to preventing cancer recurrence, be educated and empowered to know the alert symptoms and signs of common cancers so as to promote early self-recognition, so as to facilitate early diagnosis and also early treatment. Go for early correct diagnosis and correct treatment as much as possible by a competent oncologist. Go for a periodic monitoring of recurrence after treatment. Then continue to be educated on the following, knowing and avoiding all known probable and possible carcinogens, continue to live a healthy lifestyle, and continue to pray and hope for no cancer recurrence. If, despite all the above, still there is a cancer recurrence, accept it. Be contented that you have done your duties and responsibilities. Best effort, then declare, thy will be done to our Creator. So the alert symptoms of signs and signs of common cancers are the following: change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump or a mass in the breast or elsewhere, indigestion or difficulty in swallowing, obvious change in the wart or a mole, nagging cough or hoarseness. There are other warning symptoms, but the above are the more common ones. So just remember these 7 alert symptoms and signs of cancers. Now, as to the cancer death, best effort in preventing it, be educated and empowered to prevent cancer recurrence, which usually can lead to death. Go for early correct diagnosis and treatment of cancer recurrence. And continue to be educated on, know and avoid all known probable and possible carcinogens, living a healthy lifestyle, and then pray and hope for no cancer death. If still with cancer death despite the above, just accept it. Be contented that you have done your duties and responsibilities, best effort, then declare, thy will be done to our Creator. Psychological distresses and cancer journey, how to deal with them. Living a life with cancer is a journey into the world of cancer. The cancer world is full of uncertainties such as unknown specific causes, always with the possibility of recurrences after treatment, and not knowing the mode and time of exit or death, to name a few. The journey is rough, with unquantifiable physical pains and psychological distresses. The journey is, strictly speaking, a battle against cancer, full of psychological distresses. To be successful in coping with the psychological distresses of cancer when it strikes, all persons should possess the following: financial plan for the medical expenses, knowledge of the possible psychological distresses that might develop when cancer strikes for a particular person, formulation of possible coping tactics that will be used by a particular person for the psychological distresses, feeling of contentment in the thought that one has dutifully done and what should be done in terms of preparedness, mitigations, and contingency plan. Start with these initial strategies. The first management strategy is to accept the grim reality of cancer, then pray and hope, but be prepared on how to respond to these threats when they become a reality. And the second management strategy or advice is still try your best, our best, as much as possible to prevent cancer development, cancer recurrence, and cancer death. Here are my recommended, more specific coping strategies. Acceptance of cancer, trust in a competent and compassionate physician, an oncologist, spiritual trust, support from loved ones and significant others, cancer journey story sharing, intentional living plan in the light of cancer. And of course, not to be forgotten, financial preparedness. The basic strategies on financial preparedness are the following: periodically allot a portion of your revenues to build up a fund for your health needs in the future, which will include your cancer, possible cancer development in the future. Make sure that you have a PhilHealth at the minimum for a health insurance. Note And remember, when you get cancer, you are automatically considered as a PWD or person with disability, and you are entitled to 20% discount on all medical expenses and also on you can have a field health benefits already with a PWD. Identify or look for a competent, trusted, and compassionate physician who will be of help in your financial needs. Identify trustworthy and affordable hospitals or clinics to go to. For those who are near the end of life because of cancer, try one's best to stay alive and productive up to the last moment. So keep yourself busy and productive. Make peace with God or Creator or the higher force. Make peace with everybody. Endorse material possessions. Make clutter management of earthly possessions. Make an advance directive both healthcare and funeral arrangement. Bonding with the family. Enjoying oneself to the fullest up to the last moment. In the end, the best coping strategies are praying and hoping and acceptance of events and outcomes as they come. A prayer that I recommend in times of illness that embodies what I advise on what to do in the face of cancer diagnosis is the following. Heavenly Father, I consider the illness or the cancer that I got is your trial for me. I wholeheartedly accept this because I trust in your plan for me. Nevertheless, I still pray, please help me in overcoming this disease or cancer and trial with a cure as much as possible and without much suffering. Help me to have faith that you will never leave my side, but whatever be the outcome of my illness and cancer and trial, I will thank you and say, thy will be done. Amen. So, summary and takeaway, I have expound on these three major topics, three statements of facts and reality on cancer, what are the management strategies, and then how to live a life with a threat or cancer development, recurrence, and death, and what are the coping strategies. Takeaway in relation to patient empowerment, be always in touch with reliable medical information on how to live a life with a threat for cancer development, recurrence, and death. Knowledge is power. It gives power. Use the four Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in determining on how to live a life with a threat for cancer development, recurrence, and death. With that, I end my pep talk today. I hope I have empowered you to have an essential understanding on how to live a life with a threat for cancer development, recurrence, and death as part of your health management. Before we go to the question and answer portion, reminder, please take the online or OLETE for mastery of learning and have a perfect score to get a certificate like this one. I have placed the link in the chat box. Then obtaining 25 OLETE certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. And then another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the QA and interaction. Please show your faces now. Okay. That's it. Show your faces, everybody. Okay. Last call, show your faces. Let's go. 1, 2, 3. Okay. So the floor is now open for comments, questions, reactions, sharing of experiences, as well as consultations or asking for more advice on what to do. Okay. Who wants to start? La. We still have 30, actually, we still have 30 minutes. Okay. Seni, anything? Any Seni?
Po ang masasabi ko lang, praying lang, saka po manalig kay Lord.
Yeah. Okay. Pray and hope. Pray and hope. Pero meron pa rin gagawin. Hindi lang pray and hope. No? So,
Opo.
so
Di
be
ba
sure
regular check-up?
regular checkup and then know best yung mga dapat i-avoid,
Healthy
i-avoid.
food.
No? Yung dapat magpatingin at patingin kagad. No? Huwag i-delay. No? Okay. So, anybody else? Phoebe. Phoebe Caldino. 10 years na si Phoebe, di ba? Unmute Phoebe. Okay.
11 na nung October.
Okay. So, anong mapapayo mo sa amin? Survivor ka na.
Oh, survivor na nga. Wala, basta ano lang, i-monitor mo lang yung sarili mo. Pag medyo may sign ka na may naramdaman ka pagkakaiba, pa-check up ka agad. Sa ngayon, wala naman. No-monitor ko, nas remission na ako, okay naman.
Okay. 11 years ka na? 11 o
Yes
10?
po. 11. 2014 yun eh. October.
Okay. Okay. Sige, titingnan ko. Sige. Congratulations. No? So, may dadagdag ka pa ba? Kasi veterano ka na eh.
Wala na. Basta i-observe mo lang yung sarili mo. Maano ka lang na may konti kang naramdaman na pagkakaiba, pag-check up ka kaagad.
Okay. Yeah. Okay. Thank you. Anybody else? Teresa, Saluta? You want to give your input? Unmute mo.
Doc, yung nabanggit nyo nga pong best effort talagang and determined talaga po, lalo na sa healthy lifestyle. Yun po, kailangan din na yung monitoring po. So, ilang years na rin po akong doctor nyo, then yun, buti po benign yung sa cyst ko, sa breast.
Aha.
Malaking bagay po yung marami pa akong natututunan sa inyo pag nagvi-visit po ako sa clinic nyo. So,
Ilang year ka na? Ilang year ka na?
ano pa po 2000, 1998 pa po yata.
1998. So, 6 years.
1998 po, 1998.
1998, 25, 7 years.
2025 na po teka. 1998 yung pa po ako, yung ang huling opera nyo sa akin yata, 2000.
Oh, 1998. Ilang years yon?
27 po. 27 years na po ako na nagpapa-check up sa inyo.
1998?
Opo. 1998.
27.
27 na. Okay. So,
Yung pinakahuli niyo pong ano sa akin yung sa thyroid, pero yung meron kasi pa akong doktor na nung may nabasa sa thyroid ko po kasi nung nasa Bacoor Clinic po, sinabi agad na kailangan kong ipa-opera agad. Pero
okay.
po, ilang years ago na po yun. Tapos nung pumunta po ako sa inyo, hindi naman siya ganun
Oo.
monitor.
Okay.
So,
Okay.
talaga ng expert na doctor. Thank you po, Doc.
Thank you. Also, 27 ka na. Baka, okay, di ka ano. Friend tayo sa Facebook, di ba?
Opo, opo.
I-message mo, mamaya i-message mo. Baka nakalimutan ko yung picture mo.
Opo,
Sa register mo. Na?
opo.
27, tagal. Sinama na ba kita sa cancer survivor?
Ah,
Listahan?
hindi po, kasi ano lang, benign naman po, Doc.
Ha?
Benign naman yung ano nyo sa akin.
Ay, sa breast, benign naman.
Opo, opo.
Hindi cancer.
Hindi po. Pero,
Okay.
sure nyo pa rin po kasi meron at meron pong kayong nakakapa, pero hindi naman siya,
Okay.
opo.
Sige. Thank you. Thank you for attending also. Ay, kasi akala ko na-miss na kita na 27 years.
Sa inyo, ano September. September,
September. Kita tayo.
opo,
The
September.
thyroids. For the thyroid, no?
Thyroid and sa breast din po.
Okay. Okay.
Thank you po, Doc.
Sige. Thank you also. Okay. Anybody else? Sino pa? Mayan, anong comment mo, Mayan?
For me po, there's no
Veterano ka.
assurance.
Ikaw ang pinaka-veterano. Nakatatlong operasyon ka na.
Grabe. For me, there's no assurance na i-surpass the 12 years na ba ako? 12 years na cancer-free, bumalik pa rin yung lump that was last year. And then, I just only decided this year na to have another mastectomy. With your help po and your son, malaking tulong po talaga being a jobless for more than 4 years. Yun po. It also help po kasi yung BSE po, regularly, I'm doing it every day while taking a bath. So talaga it really helps. Pati po
Okay.
yung leg ko, parati ko rin chinecheck. Kasi di ba nagkaroon po ako dati when I was in Singapore. Nawala naman po yung goiter.
Okay.
Yun po. Thank you po, Doc.
So, ano yung applying what I lectured this afternoon, we don't know the exact cause, di ba?
Opo.
Tama?
Doc, for me, parang tingin ko po yung stress po Other than, yun nga, parati akong late natutulog, I don't have any enough sleep. I only sleep 2 or 3 hours in a day. Tapos masyadong malakas po yung stress ko dahil, di ba you're aware naman po na may problem dito sa bahay namin, yung encroachment daw. So talagang wala pong tigil anxiety ko, depression, sleepless nights. So talagang it triggers the lump talaga po.
So it
Cannot
can
be
contribute.
avoided.
It can contribute, but that's not the
Opo.
exact need. Hindi yan pinaka-definite na cause, no? It can
Opo,
contribute,
Doc.
no?
Genetic din
Kasi
po, Doc, kasi both sides po
both sides, no?
Opo.
So, but bottom line, kasi marami rin may stress. Maraming may stress, hindi rin nagkaka-cancer, di ba? So, yes, sinabi
Opo.
ko, we don't know the exact cause.
Opo, Doc.
Kadalasan, darating na yan, magugulat na lang tayo, no? Then, we always ask the question, bakit ako? Bakit ako? Di ba?
Opo, Doc.
So, we don't know, no? So, and then after that, yung sa iyo, nag-recur on the other side muna, di ba?
Opo.
So, then after that, nag-recur na naman on the original side, di ba? Okay.
Opo, Doc.
So, buti na lang nababantayan natin, no? Okay.
Opo, Doc.
So, then, So sana tuloy-tuloy na. Wala nang
Opo.
recurrence.
Opo, amen.
Okay. Uh, so thank you for sharing.
Thank you po, Doc.
Okay, anybody else? Yung mga walang cancer sa ngayon, any comment? Perla.
Doktor, ask ko lang, sa mga naging pasyente nyo na halimbawa meron na siyang advanced stage, halimbawa
Mhm.
stage 4 na, nakaka-recover pa rin po ba sila?
Stage 4, usually miracle na lang.
Ah,
Pag stage 4, you mean mawawala yung cancer niya? Kung talking about kung mawawala pa yung cancer niya sa buto, sa lungs, ganon, no?
opo.
Miracle na lang.
Pero meron naman siguro no kung miracle,
Meron.
parang meron naman akong nababasa na parang stage 4. Ingay naman yung basura. Pero nakaka-recover din po sila.
You can look at it this way. Let's say kung may stage 4, this stage 4 means meron nakalat sa brain, sa lungs, sa bones, no? From the breast cancer, no? So, kung sinabi natin what do you call that? Hindi naman yung talagang nawawala o gumagaling 1% lang, no? 1% lang. Pero kuminsan kahit andun siya, pwede siyang tumagal pa rin, no? So stable lang siya, pwedeng let's say mga 5 years, kahit na stage 4. Usually kasi kung stage 4, we usually prediction namin usually mga 6 months, 1 year, gano'n, di ba? O 2 years, gano'n. Pero kung minsan, tumatagal pa sila ng 5 years, 10 years, no? Again, part of the natural course of the disease yan eh. Kanya-kanyang ano yan, no? So, pwedeng, let's say, tumagal siya, and then, let's say, kung namatay siya ng other diseases. Di ba? Pwede rin yon, no? So sabihin natin, inatake siya, na-stroke siya, not because of the cancers of breast, no? Okay. So we have to look at it that way also, no? Okay. So
O nga pala, di ba, si ano doktor noon, si Senator, ano ba yun, si Miriam Defensor, di ba hindi naman po siya namatay sa cancer niya, kundi sa parang kwan na, nagka-pneumonia siya, pneumonia.
Oo. Lung
Oo
cancer siya,
naman.
di ba? Lung cancer
Opo,
siya. Okay.
opo,
Then she died of pneumonia, but
pneumonia.
hindi ko lang alam
Opo.
kung may kinalaman yung lung cancer niya, no?
Mm,
So, so once you have cancer, kumisan, you might die of other causes pa rin, no?
opo.
So, pero kadalasan, once you have cancer, majority, hindi lahat, ha? They also die, kung nag-recur, especially kung nag-recur, they usually die of that cancer, no? Okay.
Okay po. Thank you po, Doktor.
You're welcome. Okay. Okay. Jeng, anong comment mo? Yung mga walang cancer. Unmute, Jeng. Jeng? Okay. Di mo ma-mute? Wala. Rochelle, ikaw na lang muna. Rochelle, any comment as a non-cancer patients?
Hi po, Doc. Good afternoon. So, patient yung po ako, Doc, since 96, 97. Mga ganun rin po patagal. So, thankfully, up until now po, wala pong cancer. Hopefully, of course, praying na hindi talaga magkameron. Close monitoring lang po of the breast. Plus, of course, sa ngayon po, mas minomonitor yung sa thyroid ko. And,
Oo.
yun.
Yeah.
Ah,
So
yun.
anytime pwedeng sana hindi, di ba?
Opo,
Pero
opo.
anytime pwedeng tamaan ka rin ng cancer, di ba?
Opo, opo, opo.
So just be on the lookout and then be prepared for it, no? Then so kung walang cancer, we don't talk of recurrence and death anymore, di ba? Pero
Opo.
pag nagkaroon ng cancer, we have to talk about recurrence, no? And possible death, no?
Yes, Doc. Yes, Doc.
Okay.
Based po doon sa ano nyo, sa lecture nyo po ngayon, ang naano ko po, and also from friends and yung iba po na may cancer, malaking bagay po yung merong acceptance, that's number one. Kasi mas mabilis po sa tingin ko ha, kumakalat or nanghihina yung cancer patient. Pag hindi po niya na-accept, yung nagpapaka lugmok siya doon sa depression and all. So parang mas nahihirapang makarecover yung katawan niya. Number two po yung emotional support po ng loved ones. Napaka-importante po nun. Yung nagpapalakas po ng loob sa mga pasyente. Dapat po palaging may ganyan. And of course, yung pinakaano po, yung sabi nyo nga po, yung competent and compassionate doctor po talaga na mag-aalaga sa pasyente para mas mabilis makarecover.
Yeah. Okay. Tama yon, no? So, yung acceptance talaga. Kasi pag hindi mo ma-accept, depressed ka na. Pag nag-depress ka, lalong hihina ka na, di ba?
Opo, opo. Marami po ako nakitang ganyan sa friends na parang ayaw na
Mm.
lumaban, hindi na sila lumalaban talaga. Kahit
Yeah.
ano.
Yeah. So, yung iba naman, denial naman, ayaw nilang sabihin na may cancer sila. But okay lang, basta they live on, no? Wag
Opo.
lang, wag lang sila madidepress, di ba?
Mm.
Okay. Okay, thank you, Rochelle.
Thank you din po, Doc.
Jeng, okay ka na? You want to say something, Jeng?
Dok, hindi ko alam ba't humina yung sound kasi dito, kaya hindi ko
Ayan,
masyadong
ayan.
mag-
Okay na, okay na.
Yun po, Dok. Nung since po nang maging pasyente ninyo ako nung 2012 at maoperahan po, hindi din naman po cancerous yung yung bukol na tinanggal nyo na malaki. Almost 5 cm po yun kung natatandaan nyo. Yun po yung ginawa natin mula po noon na lagi po ako nagpapa-check up sa inyo na may time na meron pa rin kayong naapa. Minsan both side ng breast ko meron magkaiba ng size. Yun po yung hindi natin niligtangan na gawin na lagi monitor na ilang taon na po yun na hanggang sa ngayon yung kabo-monitor natin, sabi niyo nga po, siguro pag nagkaedad-edad na ako at hindi na ako nire-regla, mawawala na. Tapos nung last na pa-check up po sa inyo nung last July, yun sa kaliwang breast ko, totally nawala na yung cyst. Pero dito sa right side, meron pa po. Pero ano po siya, lumiit. Basta po tuwing magkakaroon tayo nagpapacheck up po sa inyo, lagi po siyang nagkakaroon ng pagbabago, unti-unti, hanggang sa mawala na po siya. Kaya talaga pong kailangan po may cancer man po o wala, talagang kailangan pong ginagawa natin yung magpa-check up sa inyo, tapos yung pagse-breast exam para po talagang monitor, para rin po maiwasan na mas lumala pa yung pwedeng mangyari sa health natin. Pati po yung sa thyroid ko, na lagi ko din po pinapatingnan sa inyo na okay pa rin naman po yung mga nagiging resulta pag po nagpapacheck up ako sa inyo. Kaya talagang salamat din po sa inyo kasi kayo po talaga yung doktor na nagsasabi sa amin na kailangan bumalik kami magpa-check up kasi syempre po nagkaroon po kami ng ibang doktor. Pagkatapos po tulad nung una ako maoperahan, pagkatapos po nun hindi na po kami pinababalik. Parang hindi naman po sa walang concern, kumbaga hindi po nagagawa na ma-follow up para kung saan meron pang ibang concern sa health namin para rin po makita.
Yeah.
Kaya thank you po sa inyo.
You're welcome. Okay. So we thank God na wala ka pang cancer, no? So yung mga bukol mo, hindi turn out to be benign, hindi siya cancer. So there's a possibility at the first time na nagpa-consult ka, baka cancer lumabas, di ba? So maswerte ka na wala, no? Okay. But keep on monitoring. There's still the possibility. Sana hindi. There's always a possibility baka hindi, kasi hindi lang breast cancer ang kalaban natin. May thyroid, may ovary, lahat, no? In other parts of the body, pwede pang tamaan ng cancer yun, no? So, babantayin lang. Yung alert symptoms of common cancer, tatandaan na lang ninyo. Okay? So, don't forget the other types of cancers. Huwag lang kayo mag-focus sa breast, no? Thyroid, no? Okay? Okay. Any more questions? Lana? So if there are no more questions, we'll call it a day. We'll, ano ba next? Next week, we will not have a pep talk kasi December 6 yon, no?
Cancer Crusaders.
December 7, we will have the Cancer Crusaders, no?
7, Sunday. Wala yun.
Sunday yon, 10 to 12, no? 10 to 12, no? So wala tayong pep talk on a Saturday, but we will have the Cancer Crusaders 10 to 12 next Sunday, no? Okay?
Okay po, Doc. Thank you.
Okay.
Thank you.
Bye-bye.
Thank you po, Doc. Have a nice weekend po.
Bye-bye.
Happy weekend,
Happy
Doc.
weekend.
Thank you. Bye-bye.
Bye.